Deep, unpin.
Yes, Dr. Jayprakash, you can start without any delay. Unmute your Dr. Jayprakash, some technical problem. You can unmute. You can share your screen. You can hear us? You can some technical problem or you can unmute your laptop.
All right, can you hear me?
Yes, yes, it is very much clear. We can hear you. You can start immediately.
All right. So, first of all, I would congratulate Kannada College for organizing this wonderful conference, and also good morning to the chairperson on all the distinguished delegates. Thank you for giving me this chance to interact with you. So I was listening some of the lectures. It was really wonderful. I was enjoying it. Okay, so my talk will be more on the technical side and the impact of environmental health on male reproduction. Right. So there is a stigma going on in the whole world that is saying that the semen quality in men is declining. So is it really declining? So there were a multinational study conducted in 61 countries, and the data were analyzed, and it is found that between 1938 and 1990, 50% of the sperm density has been gone down. So that means it is seriously affecting the semen quality and the fertility. So initially there was a confusion, or there was a disagreement that this may be due to the techniques that they use for counting the sperm, and that's why it is. But it is reconfirmed using modern techniques, and it is confirmed that it is really, it is in actual, it is declining. And if it is the situation, semen quality or sperm count quality is declining, in other words, it means that the men's health is really declining and the overall health of the human is affected. So I will come to with some of the recent, finding or observation. So the bad impact of endosulfan, which is a pesticide used for the plantation corporation in Kerala. So the plantation corporation was established in 1962, and it was in the intention was to accelerate the cash crop like rubber plantation, cashew nut, coconut, cinnamon, areca nut, etc. pepper. So what the major portion was for cashew nut development, and what they did is to increase the crop and distract from this pest. They used to use endosulfan pesticide to protect their crop and increase the yield. So it was really effective, and it was, the intention was very good to increase the economy and the production of cash crop. But at the same time, what happened is they used to spray this pesticide 3 times a year, and it got badly affected in the sense, these plantations are mostly in mountainous areas. So during rainy season, these pesticides were swept into nearby water bodies, rivers and ponds. So the immediate effect what we have noticed was, as early in 1979, there were calves and other domestic animals started giving deformed babies. So it was the immediate effect was on the cattle and other domestic animals, because they are the first, the animals, the living or things who approach this water bodies, rivers and ponds for the water. So the second was gradually affected the human beings. So because the human beings, those rural areas or mountain areas, they were also using the well water, which is not purified or cleaned for the domestic purpose. So these are some of the pictures of the presently living human beings in this area. So it was a disaster. So people are really living in miseries. So this was the question: the life is cheaper than cashew. So of course it is the improper planning of the government. So in addition to the government plannings, there were local farmers also using these pesticides for their own farms. So pesticide can cause short-term adverse health effects like acute stinging eyes, rashes, blisters, blindness, nausea, dizziness, diarrhea, and even to death. The other chronic adverse effects can be cancers, birth defects, reproductive harm, aminotoxicity, neurological and developmental toxicity, and disruption of endocrine system. So as we know that everyone is not similarly affected, but some people are more vulnerable to even any chemicals, or even we know that even for some medicines, each person respond differently. So infants and children are known to be more susceptible than adults to the toxic effect of pesticides. And the other more vulnerable group are the farm workers who has direct contact with these pesticides. So these pesticides have implicated human side effects like leukemia, lymphomia, cancers of brain, breast, prostate, testis, ovaries, and overall reproductive health of the human being. Some pesticides act as endocrine disruptors and have shown to cause serious harm to animals, including cancer, sterility, and developmental problems. So 5 main endocrine disrupting chemicals to be aware of is bisphenol. That is a chemical that has been used to make plastic since the 1950s. So to limit your exposure, what we have to do is we have to use BPA-free products, avoid eating plastics, decrease the use of canned food,
Dr.
and use of
Jayprakash, please
alternative
conclude.
storage options like glass containers and etc. The other most commonly used is DDT, which is still, we are in developing country, people are using it, but it is banned since 1970s in the United States. So what will happen is exposure to DDT can cause sperm production, and also with extra chromosome, that is abnormalities or aneuploidy we can see from exposed PDT exposed human beings, and also the miscarriage or birth defects and can lead to infertility. Dioxins are also byproducts of manufacturing products. So humans are typically exposed to
Dr.
animal
Jayprakash,
waste,
kindly conclude.
dairy, meat, and sometimes fish, where dioxins are stored in their animal, in this fat of animals and fishes. So the other endocrine disruptor is heavy metals. Heavy metals are naturally found in the air, but they are not generally harmful. It is exposed too much in some heavy metals like cadmium, mercury, and lead can affect fertility. This being exposed to lead pain or consistently working with the metals can
Dr.
be
Jayprakash, kindly
in
conclude.
overexposure to heavy metals. So another important thing we have to look into is if we have older, very old plumbing materials, the old houses, we may have to look into that because that can release heavy metals into our drinking water. The other one is most important is phthalates, which are also used in plastic to enhance the flexibility and toughness while decrease the hardness. So they are also found in commonly what we use the shower curtains, building materials, plastic blends, and also
Dr.
even our
Jayprakash, kindly
headphone sets.
conclude. Kindly conclude your lecture.
You are talking to me.
Yes, very much.
All right. So I will conclude in 2 minutes.
Okay, just conclude.
So these are the 7 parameters what we take into consideration when we get a patient or person to come with an infertility. So we will ask the male patient to give a semen sample. So we do a semen analysis on them, and these are the main parameters: semen volume, viscosity, pH, and third order, sperm count, etc. So if there is any significant observation, so we will advise them to go for an IVF. So because patients or people are get affected by this environmental pollutions, and if the reproductive health is affected, so we have to offer something. So at present, as a fertility expert, so what we do give is assisted reproduction like intrauterine insemination, in vitro fertilization, and intracytoplasmic sperm injection. So since you asked me to conclude, so I will just go through some of the slides. These are the major defects what we can see during due to this exposure of these chemicals to the human, and the effect on the semen parameters. So these are the exposure chemicals and their effect on sperm and fertility. So I'm not going through all this. So other one is a lifestyle and fertility. So everybody know that obesity is linked to sperm count and quality in men, and strenuous physical labor and taking multiple medications, excessive exercise, and substance use like narcotics and other things. And high BP also can change the sperm parameters and reducing the fertility, and also use of tight undergarments. A man
Conclude, Dr. Jayprakash, kindly conclude because we are running behind the schedule.
All right, sir. I will do it in 1 minute.
Okay, already you exceeded your time. You are already
Okay, so
exceeded time.
these are the technique what we implement to do this assisted reproductive technology. So nowadays, because of the chances of genetic deformities, we are advising every patient to undergo for a pre-implantation genetic testing to check for any genetic deformation or abnormalities before putting embryo into their uterus. So because to make sure that they are having a normal baby. So these are some of the environmental.
Okay. Thank you, Dr. Jayprakash. Actually, next speaker is in line. Thank you, Jayprakash.